Hi everyone, I'm just going to do a little video to give you a quick rundown on how to do a head-to-toe assessment on your child. Of course, ours is going to be done virtually, so it's going to be a little bit different, but I'm going to try to give you examples on how you can change it up. So the first thing you do, you're going to introduce yourself to your child and your family. Hi, my name is Caitlin. I'm a second year nursing student. I'm here to do a head-to-toe assessment for you, if that's all right. You make sure that the child and the parents or adult in the room is okay with that. You get them to introduce yourself. This is Edgar, and he's going to be my test subject for today. So the first thing you want to do is kind of gather some general vital signs. Now we're doing this at home, so not everybody has a vitals machine. If they do, you can ask them if they have blood pressure, stethoscope, thermometer. I don't have any of that stuff in my house, so we'll just pretend. Meanwhile, while you're getting all this done, you can count respiratory rate virtually. So we'll say Edgar has a respiratory rate of 25, which is fine because as we saw in the slide, for a child 1 to 5, it's 20 to 30, 6 to 11, it's 12 to 20. They're probably a little nervous, a little excited too, so they're probably breathing a little faster anyways. At this time, you could also get mom, dad, whoever to feel their wrist and feel for a pulse. Depending on the child's age, you could also ask them to do that themselves. See if they can find it and count while you time a minute. Edgar's heart rate is 110, which is perfect. So then you want to do from a top-down approach. So you're going to start with the head. At this point, you can ask the parents to, feel around the head for any lumps, bumps, bruises, any scars, anything like that. Check the hair. They could for lice, nits, anything like that might come from a school-age child. If they're wearing glasses, you can ask them to take it off so that way you can see their eyes. While you also want to check for the colors of their lips, make sure they're not blue, anything like that. You can get the parents to feel around the nose, making sure there's no cracking, nothing like that. You also want to check the ears. You can ask the parents if they have a lot of earwax, if they've ever had to be treated for a buildup of earwax, any problems with their hearing. You can also get them to do a whisper test where they stand behind the child to one side and whisper something, and then they go to the other side and whisper something else, and you get the child to tell you what they heard and the parent to agree. You also can check their sense of smell. You could have the child go find something they like to smell, and the parents give them something to sniff and tell them to ask them what it was. You can also, if they have handy, you can get them to get a little flashlight and have the child look forward and ask them to shine a light into the side of the child's eyes and check to see if those pupils are reacting, getting big or small. If they're close enough to the camera, you should be able to see it yourself. You also at this time can ask about their tonsils, if they've had their tonsils removed, their adenoids removed. That's something that some childs can have going on. If they aren't wearing any glasses, ask them about their last eye check, if there was any problem. If they do have glasses, they're just not wearing them, stuff like that. And then you want to move down to their neck. So you kind of want to find their pulse there and get the parents or child themselves to check it, tell them if it's nice and strong, beating well. If they can't find it, you also want to feel for any lumps or tenderness up and along the neck, for any lymph nodes swelling or problems. Ask them if they have any difficulty swallowing, if they're prone to throat infections, stuff like that. You can also get them to move their head from side to side for any stiffness. You also want to check to see if there's any jugular vein distension. Now, a good one to have is have your child shrug their shoulders up and down, and then so once they do that, you get the parents apply a little pressure and have them push up against the parents' hands and see how they do. Once you're done with that, you're going to move on down to the chest. Now, this is where you'd want to listen to breath sounds. Again, it's kind of hard unless the parent has a stethoscope and you're kind of virtual. So if you hadn't caught the respiratory rate at this time, you can check. You want to check to see if the chest is just rising and falling. If you notice any unilateralness, get the child to stand sideways, see if they start having barrel chest, anything like that. You can ask the parents and child about if they cough, if they have any history of asthma, if they were on a respirator when they were a baby, stuff like that. You also want, at this point, you can check for tactile fremitus, so you can get the parents to put their hands on their back and get them to repeat the phrase 99 over and over again, telling them you want it to feel like a slight vibration each time they say 99. Or that's kind of boring for a child to say over and over, so the word cookie also works pretty well. And if you want to ask them if they found anywhere that they didn't feel the vibrations, it could be there's some buildup in one of the areas, especially if a child is prone to childhood pneumonia. You can also ask if they've had a history of whooping cough, which also affects the respiratory system. Just as if they had a stethoscope, you'd also listen to the apical site for the heart and know if it's good and strong. A fun activity is you could have your child put their head on their family member's chest and listen to their heart, and then have the parent put their head on their chest and listen to their heart and see if it sounds like a normal heartbeat to them. And that way you get your child involved. Going down to the abdomen, you want to listen with a stethoscope to all 4 quadrants. Again, you could ask the parent or family member to put their head against the child's stomach and just see if they hear a lot of noises, not a lot, or not too many. For the most part, sometimes you can hear them, especially if the child is hungry. Then you can teach them to use the heel to palm of their hand to feel along for any tenderness, any swelling, any lumps or bumps or bruises, anything like that. At this point, you can ask the parents and kids as well what their normal eating habits are, if they have any problems going to the bathroom, if they go a lot, a little, if they're constipated, that type of stuff. It's kind of embarrassing, so don't be afraid if they don't want to answer or they laugh. This is also a good time if, besides checking the radio on the carotid pulse, you might, as you work your way down, you might want to tap the femoral or the dorsalis pedis. For range of motion in extremities, you want to get your kids to move their arms up and down, have them push against their parents and pull against their family members. A fun thing I think that you could do at this point to check range of motion is to try a fun song. So depending on the age, the head, shoulders, knees, and toes song might be a really good way to get your kid up and moving, and you can see what they do. An older kid, they might know the YMCA. That way it's not just repetitive over and over, just moving and doing stuff. It gives them kind of a good way to expel some of that energy, because sitting still for a long time can also be pretty hard. You're going to teach the parents to give the top of the finger a little pinch and see how long that takes. That lets you know about hydration and skin turgor. Also, you can get them to squeeze the fingernails and tell you how many seconds it took to refill. While you're on the skin and extremities, you also want to look for any bruises, cuts, band-aids. Ask the parents what's under those band-aids. Not all children, but I know my nieces, for example, used to just love covering themselves up in band-aids for no reason. So you kind of want to start to see if there's any wounds or anything that might be different than what you might expect at an active child of that age. You can also ask about any previous breaks or falls that have healed. You can check at this time to make sure the child isn't pale or clammy or flushed, anything like that. Depending on how much you just had them moving, they might be a little flushed, but you want to make sure that skin is all nice and normal. Make sure there's no tenderness or anything like that. Lastly, you can test their neurological. So you want to know if they're alert and oriented ×3. So for a child, a good way of asking is asking if they know their address, if they know their parents' names, if they know their phone number, depending on the age, what day of the month it is, and year. You also want to test their gait. So you could have them walk away from the screen and walk back, to ask them to go get something for you that you can see off in the distance, such as a toy or something, and watch and make sure their coordination and their gait are great. You would normally want to test reflexes as well. It's kind of hard to do that. And you can do the Glasgow Coma Scale as well. So that's just a brief rundown of what a head to toe might look like on a child. Of course, in person, you can do a much more thorough assessment, but working virtually, we do the best we can. Thank you.